Before you let somebody put you on blood pressure medication, make sure that the way they are testing your blood pressure is accurate. These wrist cuffs, some of them are better than others. These automatic blood pressure cuffs for your arm, they can vary widely from one company to another. The size of the actual cuff can make a difference. And the size and shape of your arm can make a difference, especially in women. The gap was even bigger with women just because of the way their arm can be shaped, from being much larger at the top to very small around the elbow. So the size and shape of somebody's arm, even issues related to the use of somebody's arm, can make a difference. I remember this many years ago. We had an ex-Major League Baseball player, pitcher actually, come into our office. And because of the way he used to throw and the development of that arm and anatomical differences from right to left, if we only used the blood pressure we found on the right side, he would have had really high blood pressure and need a blood pressure medication. However, when you tested the blood pressure in his left arm, it was completely normal. So after doing some digging with history of the patient, we understood why we were getting such a difference from one side to the other. What I'm saying is, don't just trust one reading. Don't just trust the accuracy of the provider that you're going to. Even the technique that they use can make a difference. The time of day you're getting your blood pressure checked makes a difference. Before or after meals can make a difference. If you walk in the room, lots of people have heard of white coat syndrome. You should be, when you're checking blood pressure to determine do you need medication, you should be in a relaxed state. Your heart rate should be low. Your breathing should be normal. You should feel relaxed. That is when you should get your blood pressure checked. If you're getting from the front office, from the waiting room in a doctor's office, and you've got to walk down some of those long corridors to get back to an exam room, and then they sit you down and throw that blood pressure cuff on after you've walked down that long corridor, for some people, that exertion is going to significantly impact their resting blood pressure. And to take the blood pressure at that point would give an inaccurate reading. Anyway, so if you've got blood pressure problems and you're worried about getting put on blood pressure medication, be sure to get your blood pressure checked correctly. Also, get it checked with the right equipment for your body. Don't just rely on one reading. Dr. David Morris of Magnolia Medical Center here in Murfreesboro, Tennessee. Have a great day.